One thing that all practitioners should do with their patients before lip fillers. Hello and welcome to another edition of the Vysana newsletter. I'm Dr. Sunny Desi, GP, wellness doctor and women's health advocate and specialist. And here I am in clinic. So what have I got to share with you today? So I'm going to talk to you a little bit about lip fillers and what to watch out for, what to look for. So if you're wondering what I'm doing with these are test tubes, and we're just filling them with normal saline. And the reason for that is that we want to create a weight in our centrifuge, so that when we're adding other test tubes with blood in and then they're spinning, we don't want the weight to be unbalanced. So adding a little bit of normal saline into there does help. So if you haven't subscribed to the YouTube channel already, then please do. Check us out on other platforms as well, like LinkedIn, Instagram, and of course Facebook and TikTok. And I hope you enjoy the newsletter. We enjoy feedback, and I look forward to sharing this week's hints and tips with you from clinic. Thanks very much for watching. One thing that all practitioners should do with their patients before lip fillers. This is what I want to share with you. This is what I share with all my patients. We always have a consultation, even for regular patients. They will come in before dermal filler treatment and they'll have a consultation, because it's important to understand what your concerns are. What is it that's bothering you? Is it volume loss? Is it to do with your skin? Is it the shape or change in your face due to aging? Now, one of the things is about lip fillers is that it is almost an art form, in a sense that when you're replacing volume, you don't want to overdo it. You want to respect the natural shape and symmetry of the lips, but sometimes more volume is needed. Sometimes you ask for more volume and you're unsure whether it's going to look overfilled, you don't want to look done. So these are all the things and thoughts that are going through my mind, as well as your mind if you're coming in for lip fillers. So one of the techniques that I use is to just draw on the face and highlight the natural lip parameters and lip shape, so that when we are replacing volume, then it is in the right place and the restoration looks natural, and then the lips are in the right proportion so that it doesn't, your face doesn't become unbalanced after you've had treatment. What we want to see is that no attention is drawn to the lips. Your attention is actually all focused on the eyes. When people are looking at you, they're not looking down to look at what's going on around here. What you're noticing is that everyone wants to hold their attention or hold your attention by looking you directly in the eyes, and that's when you know that a face has been balanced. That's one of the things I look out for. So I'm going to share with you where I draw on the lips. All right, so you have to forgive me for this one, because I'm actually making sure that I look directly at the camera. So when I speak to you, when I'm speaking into the camera, it looks like I'm talking to you, but I'm going to have to actually look at my own reflection, and I haven't quite worked out the parameters of this in terms of how the camera works. So I haven't got someone videoing me. So anyway, it doesn't matter. So what do we look for? So firstly, looking at my reflection here, for lips, especially in women, the main volume only needs to be in the main body of the lip. We don't want to have lip filler or volume restoration in the edges here. You often see that in some people, and that's why you can often end up with what we call a trout pout, or even a step in the lip. So what I tend to do when I'm doing a consultation is I will draw lines straight down, like so. And what we're highlighting here, they're a bit faint, aren't they? It's my stubble. Is that when we restore volume in the lips, we're only going to be doing it in this space here. Because when you pout, you can see that most of the volume doesn't go beyond this line that I've drawn here. The same here in the bottom lip. The lips should only be the width of the nostrils. So again, bit of funny angles looking at my reflection in the camera, coming back a little bit so I don't chop the top of my head off. And here. So here again, if I pout, most of the volume you can see is held in between these two lines and at the top as well. We also want to respect the fact that the volume should be 1/3 in the top lip, 2/3 in the bottom lip. Now, from different ethnic backgrounds, for example, in Asian lips, it's more 50-50, but in Caucasian lips, it's 1/3, 2/3. But generally, it's a 1/3, 2/3 rule. And then lastly, we want to respect the shape of what we call the Cupid's bow, which are these areas here. not really highlighting those very well. Overall, when I'm doing a lip consultation or when I'm doing a lip filler treatment, it's all about addressing the patient's concerns, your concerns. Like, what is it that you're bothered about in terms of your lips? Is it lines in the upper area here, which can be improved by restoring volume there? Is it that you've lost shape in your lips? You're having to outline your lips a bit more with lip pencil and then having to put lipstick on to create the shape that you want. Lip fillers done naturally can help to restore that, so that when you do put makeup on or when you do put lipstick on, you're enhancing what you have rather than trying to replace what you've lost through age. I hope you found that useful. Comments, greatly appreciated. I'm going to rub this off my face now. I wanted to share with you a before and after journey for lip fillers with a patient. Here is the immediately before and after: volumized, hydrated, a little bit of swelling, and I think you'd agree, a natural result. The patient came back for review, very happy with the results, very natural looking, and the symmetry and shape had been maintained. It's important to showcase here why lip balm or emollient over the lips is equally important, and you can see from the close-up pictures that a little bit of hydration of the lips topically can enhance a natural result that we achieved. So thank you for watching this week's newsletter. I hope you enjoyed it. This is me, Dr. Sunny Desi, and this is Vysana Life. I hope that you have already subscribed to the YouTube channel if you're watching it on there. If you haven't, go and do that now. And I look forward to sharing more with you next week in our weekly newsletter. Thanks for watching.